If your child or young person has an education, health and care plan, an EHCP, it will be reviewed at least annually. For children aged 5 or under, their EHCP must be reviewed at least every 6 months.
This is to ensure that the plan is accurately describing the needs of your child or young person, the outcomes they are working towards, and the provision support they require to reach these outcomes. When the plan is reviewed, a meeting is held where you, your child or young person, the education setting and any other professional involved meet to discuss the progress that has been made over the past 12 months.
There is a process that must be followed to ensure that the review is held correctly.
At least 2 weeks before the meeting, the educational setting must send invitations to yourself, the local authority and any other education, health or care professionals involved in supporting your child or young person, and request reports are submitted by these professionals.
At this time, the education setting will also request an updated parent-carer contribution and will seek the views of your child or young person. You'll be asked to complete an updated medical questionnaire to ensure that this information remains accurate and relevant. Reports to accompany the annual review must be circulated to yourself and other invitees 2 weeks prior to the meeting date.
You may wish to bring a friend, family member or advocate, or request that someone from the Special Educational Needs and Disabilities Information Advice and Support Service, SENDIAS, attends to support you during the annual review meeting.
During the meeting, which is typically led by the educational setting, this could be the SENCO, class teacher or head teacher, a discussion will take place to review your child or young person's progress towards the outcomes within their plan, the provision that they require, and whether their needs have changed since the plan was issued. You will have an opportunity to provide updated views from yourself and your child or young person.
For young people in Year 9 or above, the annual review should also focus on outcomes that allow your young person to prepare for adulthood.
Children and young people should always be invited to the annual review. However, you may not feel that it is always appropriate for them to participate in the full meeting, so you should discuss this with the education setting prior to the meeting.
Within 2 weeks of the meeting, the setting must issue a written report outlining what was discussed at the review, any differences of opinions, and all of the information and evidence that was submitted by any professionals working with your child or young person.
This must be sent to the Special Educational Needs and Disabilities Assessment and Review Team, SENDART, as well as yourself and any other invitees to the meeting.
Within 4 weeks of the meeting, SENDART will decide whether your child or young person's EHCP will be maintained, this means will stay the same, will be amended, this means that it will change, or will cease, this means that it will no longer exist. You will receive a letter explaining the decision that has been taken and who to contact if you have any questions.
If SENDART decides to amend the EHCP, it is required to issue the amended plan as quickly as possible and within 8 weeks of the letter that was sent informing you of the decision to amend the plan.
Please note that if your child or young person is not on roll at an educational setting, the process will be managed by the ECHO from SENDART.
If at any stage of the process you disagree with SENDART's decision, you will be provided with information on how you can challenge this and seek support from SENDIAS.
These meetings should be friendly and welcoming, and everybody should be encouraged to share their feelings. Sometimes your child or young person might want to take a friend with them. They might also want to use a form of communication which best suits their needs. The meeting must be child-centred, and this means that the setting should adapt how the meeting is held depending on the needs and preferences of yourself and your child or young person.
It's important to note that the EHCP is only amended if there are significant changes to your child or young person's needs, outcome and/or provision, or that they are transitioning to a different educational setting. Even if it's felt that the EHCP does not need to be amended, the information contained within the review is not lost, and all of the evidence gathered should still be used to inform the education, health and care that your child or young person requires.
We advise that the most recent annual review documentation is read alongside the EHCP to fully inform anyone who will be working with your child or young person. It is important to note that the meeting is not the review. The review is the entire process described within this video.
Regardless of whether the EHCP is amended or maintained, kept the same, it remains a legal document that outlines exactly what we, the local authority, the education setting and professionals in health and social care must do to ensure that your child or young person is able to achieve their full potential.
An annual review of the EHCP may be requested earlier than 12 months if there is a significant or distinct change to circumstances. You should speak with the Special Educational Needs Coordinator at SENCA at your child's educational setting in these situations.
Throughout this process, your primary contact is likely to be the SENCO at your child or young person's school. You may also contact SENDART and speak to one of our team members who can provide you with useful information and will be able to answer the majority of your questions. You can also seek support or advice from SENDIAS.